this early just so I can see if you have. Did your virtual people join yet?
I'm just gonna ask.
Okay. So it doesn't look like any of your virtual presenters have joined.
Not yet.
Okay. Could they join as soon as possible? Is this one?
No, go back.
Those are all our computers. Okay, here we go. Rebecca Jean goes. Okay, sweet. So just need to move her from the backstage. Boom. All right, give that a second.
To me, it's also about asking questions. Yeah, I think if they become a yes, yeah. Well, it's not like.
All right, let me.
Okay.
How many virtual presenters do you have?
Just her.
Just Rebecca. Okay.
Yeah.
Just.
Yeah, and the webinar is automatic.
Okay, okay,
Yeah.
perfect.
Yeah.
I just couldn't remember yesterday, I didn't start the session.
And it just did.
Yeah.
Yeah, okay, it's gonna work out.
That's why I was.
So that's.
If this is the right, have
And
you
I-
tried the sound?
It's, yeah, it should be good. I don't know if it's on right now. Oh, it is on. I'm actually don't know. It should be a bit louder. That's.
That sounds, yeah, I'm just, so the question is, what do I do with my iPad? So it looks.
You can scoot this back maybe? Like, is that more, or you
Just
want it?
that you don't want to look down the whole time, but that's how it is, isn't it? It's difficult to.
What if you, let's see if you can like elevate it, maybe a bit.
Here we go.
How do I get out of this view?
So it looks like
Hey,
Rebecca
Rebecca,
is refreshing now.
can we test your mic?
Yep, hello.
Hey, it's all good. Loud and
Yes,
clear.
good from my side.
All right.
If you have one, because she wants to have her,
I must come down.
Okay.
a little bit, oh, no, we need. I was thinking like this.
I mean, people start with tape. This is a speech, so it's okay. This is speech. This is what people.
I think it needs to be a bit higher.
Thank you for.
Okay.
No, it was good.
Anything else?
No, I think that's everything. So when the panel isn't till, the panel where Rebecca's online isn't till the second half of the session.
Okay.
What do? We just ask her to,
Yeah, she's already right there. So all she has to do is unmute, and then you'll be able to hear her in the room.
and will we see her video?
Yeah.
She's there. Would she be able to-
Hi, Rebecca. This is Andy. How are you?
So what you can do.
I'm well, how are you?
We can't hear you yet, but it's good to see you online. Just ignore my email. I just say.
Give me just a second. Be right back.
Yeah, just if we can move her temporarily, because the first part we've got, she will be ahead on the screen that nobody can understand.
Yeah. So we're just sorting out the audio. Cool. Great. How's it going? Okay.
It was nice. We went to a fantastic restaurant. It was the first time that I met like a lot of like the WaterAid America team. So it was.
Is this your mic?
No, she's just. What about you? After half an hour?
I went out to
Hey, Rebecca, do you mind giving us another mic check, please?
Sounds good. Are you hearing me?
Yeah, we can hear you now. Thank you.
Okay, great.
Sweet.
So if we were on the screen a bit later,
Yeah.
but
So-
just don't cover it.
Yep. So I'm gonna just set it right here for now. All you have to do is drag it to the right, and then you can put it down wherever you want to put it down.
So it's like an extended screen.
Exactly. Yep. Cool. All right. Not a problem. Do you guys need anything else?
No, I think we're good. And it
Okay.
will automatically start recording and all of that jazz, right?
Yep, it is already doing all that.
Perfect.
Yeah.
What time?
Right now it's 8:28.
And so if anyone's asking questions, they should speak into the microphone.
Yes.
And the panel members should also speak in the phone.
Directly into the microphone. Yes. If they speak to the side of it, you're not going to get good audio.
Get it?
Yep. Okay. And if you need to, you can take any microphone out of any stand and walk it around wherever you need to.
Thank you.
If you need me, I was just about to say that. We are right across the hall.
Okay.
So,
So should we do run a show? What's the run a show again?
huh? I'll open the session and hand it to Cecilia, and then I'm actually going to mention that because I'm going to give a slight overview of the session, so they'll know that you're going to present on on safe amount of sanitation, how
Shall I
alignment.
go straight in, or are you gonna?
No, from Cecilia, you'll go straight in. Yeah, sorry. Yeah, I'm only going to do the handover to Cecilia, but I'll have mentioned in the overview that you'll be taking on after her.
Yeah.
And then from there, it's you all the way up till the first panel, where I'll come back to introduce.
On that last slide where it has the 3 panel members.
Exactly. I'll
hand over to
introduce the panel and then play, and then I have a slide to transition to panel 2 where I'll introduce Elijah. And we'll move Rebecca on screen. Might need a little bit. I think figure that one out, but I think it's anyways. And then after that, you'll close, and I won't. Yeah, right after the
close.
panel, you'll jump in and close.
I'll just do 3 takeaways.
Yeah. Yeah.
I'm gonna wrap up. Okay. Thank you.
Okay, it's time. I feel like we need to give it. We're gonna just give it a couple more minutes. It's now 8:30, but I think people are still enjoying coffee, which is not a bad thing. So we'll wait a couple minutes. Yeah, they didn't ring it yet. You have about 30 minutes. Yeah, so don't worry.
I will sort out everything link and drive and I give 5 minutes to Anna.
Yeah. And I'll also just keep eye on time, so if you ever, like, I don't know if you've got a watch on, but I can keep an eye on.
Yeah,
so
no,
if
no,
you look-
I have time.
Okay, good,
I
perfect,
will be timing myself.
perfect. Okay, so we're going to get started. Hopefully not, but just in case you are wondering what room you walked into this morning, this is the session on strengthening government-led systems to accelerate safely managed sanitation systems. Oh, that's great. We'll actually maybe receive a couple others. Yeah, so it's great to see so many people. I know Wednesday we're starting to kind of run out of steam, but we have a great group in person, but also we have a number of people online, which is fantastic. So just a bit of an overview of what this session is going to cover. First, we're going to have some opening remarks from the director of the WASH section of UNICEF. And then Andy is going to talk about safely managed sanitation and how alignment on what we mean is foundational to be able to accelerate safely managed sanitation across the globe. And then we're going to have two panels. The first panel is going to offer some insights from government representatives from Ethiopia, Cambodia, and Tanzania, who all facilitated customized workshops to contextualize safely managed sanitation for their countries and evaluate blockages to be able to identify immediate next steps to be able to accelerate that progress. And then finally, we're going to have our second panel here in the room, and it's going to be a conversation about what else needs to be done, improvements, and ways to replicate this alignment, this conversation, to be able to accelerate towards SDG 6.2 globally. And with that, I'm just going to hand it over to Cecilia Sharp for opening.
So, good morning, colleagues, and hi, everybody, wherever you are joining us in this session. I'm really honored to be here. It's such an important topic that we're going to talk about today and also really learn from country offices. It's amazing. So I have the pleasure to kick off this session, which is co-convened between UNICEF and WaterAid. And it addresses the critical aspect of public health and sustainable development that often remains in the shadows, namely the importance of strong government-led systems to deliver safely managed sanitation services. So we have made so much progress in ending open defecation the last decade, from over 1 billion in 2015, this is amazing, to less than 419 million people practicing open defecation in 2022. We are on track to hit ending open defecation target by 2030 and can reach near universal coverage on basic sanitation. But if we are to maximize the impact of sanitation investments on societies and the economy, we need to ensure that health impacts are achieved. Safely managed sanitation is the new rung on the sanitation service ladder. This is because if we are to ensure results for children, we need to be achieving resilience in our public health systems. With a clean environment over a sustained period of time, children can grow up healthy and reach their full potential. The number of public health emergencies around the world right now is at an all-time high, and cholera particularly is expanding. Sanitation is a critical component in ensuring we eradicate some of these 19th century illnesses that still is afflicting too many countries in the world. The work ahead can seem daunting. We still have a huge data gap, with only 80% of countries with data availability for safely managed sanitation. This is largely because it's not just about the number of people with access to toilets, but also what happens to the fecal waste. This is the new rung then. Questions like, how well is waste contained in the ground? Is the waste safely emptied? Does the waste reach the treatment plant? Or is it being adequately treated? Or is waste being safely reused? And so on are questions that we need to have answers to understand safely managed. So when governments don't know the answers to these questions, they cannot even start to address the problem. And cholera returns yet again, year after year. The role of governments and their different agencies are central to ensuring sanitation services. Already they play a significant role in creating demand for services, direct service provision, investing in infrastructure, but more importantly, they have the role to ensure quality services through legal and regulatory frameworks, providing clear policies and guidelines for service providers, make financing available, and adequate monitoring. At the end of the day, sanitation is a public health issue, a human right, and is a government responsibility. Sanitation services are delivered in a complex system of many actors and factors. It's widely recognized that coordinated, intentional strengthening of these wash systems, or enabling environments, that we also call them, is essential to realize the SDG 6.2 by 2030. In 2018, the United Nations High-Level Political Forum, or the HLPF, recognized SDG 6 and Target 6.2 in particular as being off track, so the sanitation target. As a result, UN Water developed an SDG Global Acceleration Framework, which identifies 5 system-level accelerators to support the achievement of SDG 6, which are governance, financing, capacity, data and information, and innovation. It calls for collaboration, at-scale efforts, working in partnerships with government agencies and all stakeholders together. Now, I got lost, sorry. This means our role as development partners also needs to change. We need to do less of service provision and delivery and more upstream work, system strengthening. We need to show how these services can be delivered in a sustainable and cost-effective way through existing national systems and government structures. This is why in 2022, UNICEF launched a game plan to reach safely managed sanitation. I think it might be on the tables and desks in this room somewhere. I saw it. Our game plan runs to 2030, and it puts government firmly in the lead. It focuses on system strengthening approaches, supporting the development of policies, strategies, planning, regulations, as well as strategies for sustainable funding and financing of the sanitation. It also reflects UNICEF's commitment to climate-resilient sanitation, as achieving safely managed sanitation is about risk-informed programming to reduce risks along the sanitation chain, especially those related to impacts from climate. The game plan also focuses on engaging private sector at both local and international level, and it encourages innovation. And as a co-custodian of monitoring SDG 6.2, UNICEF will support robust monitoring, transparent reporting, and the use of data and evidence for decision-making. And we will work with all stakeholders, civil society, development partners, development banks, NGO, academia, and the private sector, ensuring coordination and collaborative solution with each organization taking clear accountability. This session today builds on last year's UNC side event where we introduced the game plan for safely managed sanitation. And we have had a lot of interesting interactions with partners on the game plan since then. Hopefully these case studies you will hear about today from Ethiopia, Cambodia, and Nigeria will inspire us, UNICEF and WaterAid, in promoting safely managed sanitation in more countries. In conclusion, the provision of safely managed sanitation services is not just a matter of public health, but a fundamental human right. It's a cornerstone of sustainable development. I encourage the audience here today to share reflections, bring your own experience, and supporting this transformational change and role of government in providing safely managed sanitation services. Let us collectively work towards a world where no one is left behind in the quest for safe and dignified sanitation, and let us acknowledge the vital role that development agencies play in supporting on this journey. So I'm looking forward to a really exciting and interactive discussion and session today. Thank you.
Good morning, everyone, or good afternoon if you're online. My name is Andy Narracott, and I am with UNICEF HQ as a WASH specialist, and I'm going to, as Laura mentioned, just sort of introduce what we're talking about here when we talk about safely managed sanitation, and this specific intervention we're talking about today, which is around these safely managed sanitation workshops for sector alignment. Some of you, many of you, will remember WSP in this room, and their brilliant cartoons that they brought out regularly. And this picture on the right there sort of demonstrates what the thinking was around the MDG period, when we assumed that if a household had a toilet and water on premises, then their kids would grow up nice and healthy and strong. But if not, if they didn't have a toilet on site, then malnutrition and stunting would happen. But it's not. We know now, evidence has shown that it's not as simple as that. We know, well, sanitation, what is it for? It's to improve, it's human right, and it delivers cost-effective health and economic and social benefits for people. But we know the way it has been implemented in the past wasn't delivering those health impacts and those benefits that we wanted because of the way sanitation was being implemented. So we know now, as a result of the evidence, and I'll show on the next slide, that clean environments produce health impact, not just access to a toilet. Because what happens when that toilet fills? What happens to the waste? Is it actually an improved latrine? Is the slab, cleanable and preventing flies from entering inside and spreading disease? Is that household adopting hygienic behaviours in how they use the toilet and hand washing afterwards? So it's not as simple as having access to a toilet, as we know. So this was just briefly on the evidence on why safely managed sanitation. This study was done by Jennifer Wolf and partners that shows basically the way that sanitation was being implemented was not having the expected health benefits, actually through the SHINE and WASH benefits trials, large randomized controlled trials. And each one of these dots on the graph is an epidemiological study of water and sanitation interventions. And if we, that line there shows little or no health impact of those studies at the end of the intervention. And if you look along the bottom line, it shows on the left-hand side a sort of dirty environment with high fecal count, and on the right, a clean environment. And what we see is that, those along the bottom is what the conditions were like at the end of the study. And what we're seeing is that until we get a very clean environment, we are not seeing the health impact that we desire. So when you see a much cleaner environment, when you're reducing the amount of pathogens that are entering the environment, then we see that these health impacts are arising. And that's why we need clean environments and safely managed sanitation to help deliver that. Everyone recognizes the sanitation chain. These hazards, these triangles, identify where excreta is likely to enter the environment and to come into contact with people. At the toilet stage, in the containment, in the emptying and treatment and reuse. And as a result, WHO and the Sanitation Health Guidelines, which is an excellent reference, brought out the new F diagram. I don't know if it was WHO, but anyway, this represents the mechanism that illustrates that these sanitation hazards exist all along the sanitation chain, and they reach the host, the person, through a variety of mechanisms, through hazardous events. So as a result, in 2015 at JMP, we had this new rung on the sanitation ladder of safely managed sanitation, that is defined as people using an improved sanitation facility that isn't shared, but also ensures that excreta collected remains isolated from human exposure. And obviously this JMP is really just for global monitoring. It has several indicators, and those are the key indicators for safely managed sanitation. And according to this definition, there are 3 means by which excreta are considered safely managed. They can be transported through sewers, which is the top circle, wastewater treated on site. They can be emptied from local storage pits or septic tanks and conveyed to a treatment plant, which we call it emptied and treated off-site, or they can simply remain in the ground, which, treated and disposed of in situ. So good news is that there's been massive open defecation reduction, as Cecilia mentioned, from 1.3 billion in the year 2000 to around 500 million in 2022. But still, 3.5 billion people lack access to safely managed sanitation services. And with the reductions in open defecation, they don't always translate to basic sanitation or more. It's often to limited, so unimproved sanitation, so not delivering the health benefits, despite massive success in CLTS and other programs over the years. So how can we change this around? How can we accelerate progress? The GLASS report in 2021 highlighted a few things. There's from 118 countries that responded to the survey, we found that many countries have policies for sanitation, but very few of them have the resources, sufficient financial and human resources to implement them. Equally, on a capacity level, that 61% of countries reported having less than half the trained professionals needed for on-site sanitation, which is a big problem now, because as of 2020, the more households are using on-site sanitation compared to those with sewer connections globally. So capacity is a huge issue, emerging, growing issue. And on data, about 25%, or a quarter of countries reported performing sanitary inspections at premises, so actually looking in the containment. So that's why, as Cecilia mentioned, we brought out the game plan to reach safely managed sanitation. We believe that you need strong systems, a strong enabling environment to cut those pathogen pathways, those pathways of excreta leaking into the environment along the sanitation chain. We need a robust policy environment that considers equity and sustainability of services. We need financially viable, affordable sanitation services. We need government-led data and information systems that inform and track inequities, that track risk as well, the risk of excreta leaking into the environment, routine monitoring by government, and a competent sanitation sector that where actors have the needed skills and capacity, and we need innovation all the way along that. So hence, we need massive acceleration to get anywhere close to reaching the SDG target. But we want so UNICEF and WaterAid brought out their strategies, their game plan in 2022 to reach safely managed sanitation, and WaterAid's new global strategy, which is the ambition of increasing progress towards universal access to safely managed sanitation and continuities of services. So to implement and to get these strategies rolling, we started off with responding. Well, first of all, UNICEF and WHO in 2021 had a sort of global internal webinar on safely managed sanitation. Over 75 countries attended, and it became very clear that there wasn't a very good understanding of what is safely managed sanitation. So this could have sparked a sequence of events, a training. We partnered with WaterAid through our global partnership to do some training, workshop trainings to bring the sector together in a few countries to align people on what is actually safely managed sanitation and what needs to change of government systems to help shift the focus towards safely managed sanitation. Because we found many countries were still in the MDG period. Many policies were still talking about access to toilets. The data systems were still not collecting the necessary information. So this we're going to share briefly about the SMS workshop in the first panel. But briefly, what was it? Many people in the room will know what we need. Sanitation splits across many different sectors. So we brought key ministries together, subnational level as well, where sanitation is implemented. So some of them, the subnational governments, so municipalities as well, regulators, National Statistics Office, private sector universities, financing agencies, all in one room over a 3-day period to do the training on safely managed sanitation, and with that new knowledge to understand, well, how do things need to change? What government systems need to change? So they were Ethiopia, Tanzania, and Cambodia. They all had similar kind of objectives, mostly around rationalizing the need to accelerate progress towards safely managed sanitation and get a common understanding, get aligned, everyone in the sanitation sector aligned on what is safely managed sanitation. But then look at policies and strategies and monitoring mechanisms to help achieve the objective. It went over a 3-day period generally, recently now adding on a high-level event of some sort to engage with political leaders on safely managed sanitation. But it happened over a 3-day period, as I said, with training, looking at the policy planning, looking at the institutional mandates and gaps along the service chain for different functions like service delivery, regulation, public health messaging, etc. It was very interactive. lots of games and activity, as you can see, brainstorming the sort of risks along the sanitation chain. And there was a real, aha moment when people were realizing that, yes, there's excreta everywhere and we need to do something about it. So it's a real sort of galvanizing event with, recently in Sierra Leone, for example, just bringing everyone together was quite significant, and they agreed to set up a technical working group as a result of it, cross-ministry, cross-sector. This is a sort of work in progress of how we see the workshop fitting in within the sort of grand scheme of things. That sort of initial sector alignment is necessary to bring people together to understand what is safely managed sanitation, to get a common vision of what needs to change through work planning, understanding things like what small actions need to happen. Longer term, obviously, policy update. Shorter term things can come like bring key decision makers together to advocate the need for an updated policy, for example. And then various things along the 5 SDG accelerators that Cecilia mentioned are at the national and subnational level, depending on what is needed, what opportunities arise, things like a new strategic plan being coming up for review, or other opportunistic things are happening to tie into that, to what we call leverage points and entry points for systems change. So that gives a very rough example around at national and subnational levels of how development partners can support government improvements in systems. I won't run through it all, but that's how we see the workshop sort of fitting in within the general sector. And when we come to Q&A, I'd be love to have some questions and to probe about this. Thank you very much. Now I'll hand over to Laura for the first panel. Thank you.
And when he says he's handing over to me for the first panel, I'm actually not moderating because this is a video recording. So I'm kind of off the hook for being up front here for too long. But as Andy was talking about this, the workshop was meant to be the first step. I mean, and of course, so much has been happening in all of these countries, but that foundation of being able to articulate and envision what does safely managed sanitation look like uniquely in each of those countries, to be able to have some of those bigger conversations about where are the blockages, whether it's policy, strategy, monitoring. Everybody needs to know where they're heading, as well as what that might look like given the context. So I think that was really important, is that this workshop really leveraged the expertise of all the stakeholders, but made sure that everybody left with that kind of base and foundation to continue the conversation, continue the progress after the workshop. So this is really to kind of catalyze or accelerate what's already been ongoing in each of these countries. This first panel is we're going to have government representatives that were leading actually, and part of the facilitation of each of these workshops, reflecting on the specific objectives, outcomes of these workshops, and talking about some of the blockages and commitments that they've taken as a result. And again, the commitments that we're talking about are, not necessarily, there's a lot more discussion that needs to happen. These are the immediate next steps in the next 6 months to next year to really make sure that the right stakeholders are in the room to start talking about, policy, monitoring, strategies, and many of these other building blocks that we just saw. On the panel, we have Mr. Wande Wube from the Federal Ministry of Health, Ethiopia. As well, we have Mr. Selemani Yande, the President's Office, Regional Administration and Local Government from Tanzania. And then lastly, Mr. Lecham, who is from the National Institute of Statistics. And moderating the panel is my colleague Maya Igarashi Wood, who isn't here today, But yeah, we're just going to listen in, and then we'll go to the next panel.
What were some of the key actions or priority activities identified at the workshop? And then how are you progressing to roll out, implement those identified key actions?
These key activities that were outlined during the workshop were, the first one is to establish advocacy team, the team that advocates safely managed sanitation is achievable and doable in both rural and urban contexts. So the other one is just including SMS in national monitoring system in the existing or during the revision of our monitoring system. The third one was preparing a protocol that guides safely managed sanitation. Regarding their progress, we have at federal level, we have established the advocacy team from Federal Ministry of Health, Ministry of Water, Energy, UNICEF, and WaterAid. And this advocacy team has advocated the safely managed sanitation in different workshops, gatherings, and meetings. That safely managed sanitation is achievable and doable in the Ethiopian context. The other one is the monitoring system. You know, in Ethiopia, we have plans to transform the sanitation and hygiene situation of the country. This program is known as Tsedu Ethiopia. Tsedu means in English, it is an acronym. It is TSEDU. That means Total Sanitation to End Open Defecation and Urination by 2030. This program will be led by the Prime Minister of the country. There's a workshop. We have revised this document to make safely managed sanitation our primary target. And the other one is preparing of a document, a protocol for safely managed sanitation. So we have included this plan under our annual plan, our under Ministry of Health annual plan, under Ministry of Water and Energy annual plan to produce a national safely managed sanitation protocol. So this protocol will guide the country's safely managed sanitation.
We developed the national strategic plan, which ends in 2025 for and then the hygiene. And because like we have 1.5 year to reach 2025, June 2025. So what we agreed is we create a supportive environment for this one, and then for this safety sanitation, like incorporating of like updating the management information system, and then developing like national guideline for safety sanitation. So this will go together as parallel. So it will not go direct to the issues like among the policy document is to develop the guideline for safety management sanitation. So this one will be developed on the process after completing those training. So we start developing after having now we have updated, then development will be done, because development document can be done within like a month. After 3 months, then the document can be signed, so as can be used throughout the country. So that's the priority we will be doing. So among, I think, the resolution of the National Technical Working Group during the validation and approval meeting is also to have the the national guidelines for safe managed sanitation. And from there, I think, as you know, it needs also resources as to like having the consultants and that will lead the process of developing that document. So issues, of course, ahead, the priority activities, and we are actually looking on it. So as we discuss with our partners and the government, how we can all contribute to our development of that particular national guideline.
And I would like to come back to Cambodia on the monitoring aspect. Through this workshop, what were then the key priorities, activity to address these gaps that you identified?
So the proposed action, there are a number of key priorities, but the first point of priority action that we agree among the line ministry as well as the development partner, in particular the UNICEF and WaterAid. The proposed action for the above issue, the NIF will be lead the technical discussion and conducting a survey through the financial and technical support. That we will be conduct a sanitary inspection survey to fill the data gap in terms of the containment, clarify any misinterpretation, and better distinguish between the septic tank and pit. So this exercise, of course, we will conduct in parallel the existing current Cambodian Socio-Economic Survey 2023 that right now will be complete by the end of this year. But of course, we propose the sanitary inspection survey will be conducted in the coming month soon, the upcoming months. I mean, maybe we will around December this year. And of course, we will also in the future will be included in the key question to fulfill of the definition in terms of sanitary as well as the sanitation services will be discussed with line ministry, of course, with the UNICEF support for the include into the Cambodian Socio-Economic Survey 2025 round, as well as to align this agreed question into the Cambodian Socio-Economic Survey within during this time period as well. So that hopefully will be lead to more systematic and efficient analysis to estimate a safely managed sanitation in Cambodia. So this sanitary inspection survey will be first the action point agreed, as I said during the SMS workshop conducted in May this year in Phnom Penh, Cambodia. And of course will be constitute the fundamental as well as the foundation for all of the next step, especially for the include of the roadmap to develop for the better data collection and monitoring SMS, and of course building from the said workshop I mentioned earlier.
As you are progressing already to advance the action plan, have you seen and faced any challenges in advancing actually that workshop, or anything that you foresee as some challenges or barriers to really accelerating the progress and achieving the safely managed sanitation for all in Cambodia?
Yeah. Thank you very much. That very good question. So far during the discussion as well as among my colleague discussion, we are related remain discussion a lot. As you may understand already, Cambodia experienced conducting a lot of survey and sanitation question already included in those surveys. However, we are remain challenging an issue regarding to the point that I raised earlier, in particularly regarding to the different use of the data from different survey. And of course, in terms of coordination between the global and national SDG monitoring, the main point of that need to understand about the sanitation data collection, of course, is through different survey and relevant indicator report uses different methods. In terms of the division, of course, it's still different. So this overall discrepancy between the national and global approach remain a challenging issue, in particularly to align and adopt the JMP estimate, for instance.
Maybe the main challenge will be second populous country, and therefore we need a huge amount of sanitation technologies, products, and services to address the safely managed sanitation to address our households.
Was there any surprises or both positive and negative throughout this process of coordination, collaboration with different sector partners to organize these workshops, and then also as an outcome, anything that you did not expect?
What the key important again related to the discussion during the last May workshop among the various development stakeholders, we also surprised about some input and recommendation to better to include some additional questions to reflect in particularly on the climate change. Since Cambodia very often affected by the flood or experience of drought, something like that. So I think that the level of monitoring up to the higher layer of the sanitation, not just focus on the safely managed sanitation, but we should align this concept with the response to the climate change as well. This is the important and the point that I think that are very get us interesting during the discussion, as well as one be hearing from those policy maker as well as the data user they are provide. In particular, those who are working at the subnational level, at the grassroots level. And of course, the population that we always learn through the social media who mentioned about this point. So I hope that so far I never think about that. We just thinking about how to provide the data from our survey.
One thing I think also was I was worried. I was just worried when I was going to the workshop that if with these low middle income countries and in low middle income countries, how can we achieve safety managed sanitation? That was my worry because of my present understanding by then that maybe it will be very difficult for like the marginalized communities and the rural communities to attain that one. So after some clarity on safe sanitation, then I realized at the end, which was not my expectation, that yes, the country, we can strategize and they have, because now safe sanitation, it has to do also with on-site sanitation, like on-site safely containment and treatment. So previously I was thinking like it has to be off-site treatment, something like that. So I really thought that, yeah, in most of the countries, rural parts, and we don't have like the stewards, public stewards, and whatever. So it was like, yes, we are going to this workshop, but it's like we're going to something which we cannot achieve. So have the explanation that of this we can achieve, because in rural areas they can do some on-site sanitation, which is self-managed, and in urban areas they can do self-managed, which is off-site sanitation. So that was something which I was not expecting.
What piece of advice would you give to other countries which are thinking to go through the process that you went?
Because the involvement of the higher level, especially those person who working at the policy level, must be included in this process, and of course to not just about the technical in terms of the data analysis, but the terminology used between a context of each country, as well as the language of the use and translation, as well as to align to the real situation and facility in place, must be understood well among the policymaker, data collector, and as well as the data planner.
My advice to other countries is to develop a sustainable system for sanitation and hygiene. How can you do this? I advise my fellow governments to own the program, and to ensure like they are structuring the program to be one program, one sanitation and hygiene program in the country that provide a platform for all stakeholders, both development and the private and the government itself, to operate within the platform of one campaign, to minimize opportunities for silos implementation. So as you can try, as we can enable like mobilizing all funds to support one program. That is number one. Another issue is to ensure that the sanitation is actually it is mainstreamed through the government documents, and it has to be the agenda for the leaders. And another thing is to have also one monitoring system, that all partners, their work, the outcome of their work is reported through the system, one system. So that one really, I think that one will enable more collaborative and more uniformity on implementation.
Some piece of advice to other countries that think to organize the same workshop. The first one is just to communicate relevant stakeholders, universities, government officials, and development partners, financial institutions, and also private sectors ahead of time to be a part of this training, because all these are important. They can contribute to safely managed sanitation. The other one is, my advice is safely managed sanitation is doable and achievable. So I encourage them to set a target for safely managed sanitation. So it's very easy. And also I encourage them to contextualize safely managed sanitation according to their local context. The other one is they should invite higher officials, government officials, to get buy-in for safely managed sanitation. And the other one is if they have a big initiative, water-related initiative like SEDU, like Ethiopia, it's better to integrate this safely managed sanitation in this big water-related initiative so that they will succeed without any doubt. And the other one is they have to think the monitoring mechanism for safely managed sanitation. This is all about my piece of advice for the countries that think to organize a workshop on safely managed sanitation. Thank you, Maya.
With that, I would like to conclude today's discussion. Thank you very much.
Thank you very much. Have
Thank
a
you.
nice time.
Thank you very much. Yeah, thank you.
Thank you very much. Have a
Dana
great
Walu in Ethiopia.
Thank you very much, Ma.
I think we're going to pause just briefly because of the presentation earlier, and unfortunately, obviously, these panelists aren't here with us today, but before we go into the second panel, I want to make sure that we address any pressing questions. So if anybody does have a question, you can make your way to the center, and we'll do our best to respond. And if there are no questions, we can move forward. And if they come up, they can also come up during the second panel. It was on Monday, I believe, that in the plenary that somebody said that that it's not the winner takes all when we talk about system strengthening, and I think that is what is led to the second panel to be able to listen to others in the sector and talk about how, what improvements need to be made, and how we can learn and replicate to make sure that globally we're finding that alignment in countries to be able to shift towards safely managed sanitation. So I'm going to turn this over to Elijah Adira, who is the Regional Manager, International Programs WaterAid, to moderate.
Thank you very much, UNICEF and WaterAid, for giving me this privilege to moderate. I'm not the expert. I'm going to bring, I understand the system strengthening very well, and I've done a lot of work with it in terms of the 11 building blocks and based on the ground and the context. But I think today we have experts that are probably going to give us more information about the improvement and replication of government-led systems to kind of accelerate the shift to safely managed sanitation globally. We know that sanitation has been left behind. Even in some of our developing countries, even meeting the basic sanitation is a huge issue. So we are talking a little bit more bigger of safely managed sanitation, and we just want to make sure that we support government-led systems to not to give them fish to eat, but at least to teach them through the system strengthening approach so that they can strengthen the systems and therefore make sure that they can deliver, because governments are responsible to deliver sanitation and other services. Actually, we are complementary. I have 4 panelists with me, and I think 3 of them are in this physically here. I would like to invite them to get in. Yeah, and then there's one that is online. So I would want to call Sophie to come forward and have a seat in front from WHO. I will give you about 30 seconds to introduce yourself and tell us something that you are trying to support government-led systems, what you are passionate about in that. And then I also want to call upon Rebecca. Rebecca is the one that is online, yes. I think he will be there. And then I would like to get Adnan. Adnan, please come in to sit in front. These are the key experts. And then Kasenga. Is Kasenga here? Please have a seat. And then we have Rebecca online. So what I will do quickly, I will be trying to manage time. I'm quite very strict with time, but also very relaxed and flexible. I want to feel at home. So I will give each one of the panelists, I'll start with the online, Rebecca. Just have kind of 30 seconds, introduce yourself, and just tell us one thing that you are passionate about in terms of what you're doing with regards to the government-led improvement and replication of of systems to accelerate the safely managed sanitation.
Thank you. Sorry. Thank you so much. I'm Rebecca Gilstorf, a senior water and sanitation specialist at the World Bank. I'm based in Madagascar, which is why I'm not with you all today. So greetings from quite a ways away. And I think the thing that I'm most passionate about is seeing this increased focus on universal access and really thinking about how do we reach the people who are the hardest to reach, and how do we support governments in prioritizing their programs and their approaches to get us there. Thanks.
Thank you, Rebecca, and thanks for that. I will go to Sophie.
Okay.
Yeah. Introduce yourself.
Well, nice being here on this panel. My name is Sophie Boisson. I work with WHO within the WASH unit. I guess what I'm passionate about, I really like evidence and how this evidence translates into policy, translates into action. So really evidence informs, data informed decision making. That really something that's close to my heart, starting as a researcher and now moving into the broader policy environment. So that's it from my side.
Thank you very much, Sophie, for that. I will go to Adnan.
Thanks. This is Adnan from the UNICEF Bangladesh country office. I'm working there as a WASH officer, and my passion is actually to transform the policy to the action that is related with the sanitation. Thank you.
Thank you, Adnan. We can go to Kasenga.
Good morning, everybody, and thank you very much, moderator. So, as introduced, my name is Kasenga Hara, Senior Inspector Technical from the National Water Supply and Sanitation Council, which is a regulatory authority for the water supply and sanitation subsector. My passion really is to see to it that the sanitation subsector thrives as much as the water supply subsector. So I am a firm believer that this is going to be as viable a subsector as the water has been. Thanks.
Thank you very much. I'm glad we have a regulator here. Commercial utilities, very important, providing services like water and sanitation. So that's great. Within the, as I said, we are looking at how improvement and replication of government-led systems to accelerate the safely managed sanitation. And I have this wonderful panelists. I would be asking them just one question, each one of them. And I think that you have about 3 minutes to just crack it and respond. So I will basically start with Sophie. So Sophie, the question is, what specific initiatives, what is the specific initiatives or strategies that has WHO taken to actively support governments' efforts to shift towards achieving the safely managed sanitation? And what are the key outcomes or the progress that you have so far observed as a result of these efforts? I'm not sure whether I'm confusing you or making a little bit more sense.
I've captured all your points.
Okay.
That's fine.
Thank you.
No, thanks. So, so it's, I would say as a, sorry.
If you can speak, yeah, so
Sorry.
that everyone can hear you.
So I would say as a starting point, the development of the sanitation and health guidelines. So really, we really went back to the evidence, synthesizing, more than 1,000 of studies to really confirm that, and perhaps it's a little bit obvious, but it really confirmed using evidence to demonstrate that the way we've done sanitation before, is not sufficient to make the impact on health and have broader socioeconomic benefits. So the guidelines provided clear definitions on what safely managed sanitation means at each step of the chains. It provided recommendations, but also how to implement them. So in the years since the guidelines have been published, we're seeing that some of the core messages are being reinforced, are being amplified, and and we see that definitely in the discussions, like system strengthening, regulation is clearly in everyone's mind. you know, of course, we see that also like through the African Sanitation Policy Guidelines, through the game plan, and the forthcoming Lancet Commission on Wash and Health. And it's an exciting moment as well because we see a lot more alignment across different organizations, across different actors of the sanitation sectors. And I think that's really important and that's really exciting because it's really critical to achieve progress and really support countries with just one voice. In terms of like more the practical activities that we've been developing some learning package to support implementation of the guidelines recommendations, so through open WHO courses, also through the update of the sanitation safety planning manual, which includes a much more focus on climate resilient sanitation systems and identification of climate-related risks, and also associated learning hubs, but also updating sanitary inspections for sanitation system, which can be used for regulatory purposes. We've been providing direct support to countries, but also we've been really working on strengthening capacities of regulators through the WHO's network, international networks on drinking water and sanitation regulators. So the past year there's been an increased focus on sanitation as part of the network. We've increased membership on sanitation regulators. It's really a platform, and some of you may have been to the session that we had yesterday. That's really a platform to support peer-to-peer exchange and learnings, but also we've been really strengthening links with regional networks like ADERASA and ESAWAS, and further expanding to really encourage this exchange, but also providing technical guidance through these networks. Just wanted to highlight some of the works around also around the monitoring and the looking at the use of data for the data that are used at local level, and that can be data on safely managed sanitation that can be used for decision making, especially at local level. There's been also lots of work around sanitation workers through working with partners and the Sanitation Workers Initiative, which is a global advocacy partnerships to really raise the profile of the sanitation workers, but also really have a number of initiatives to improve their working conditions. So in terms of the progress results, to summarize briefly, I think it's been very encouraging over the last few years to see that there's more awareness on safely managed sanitation, so on systems, on regulations. We have tools available in the sector to support this shift, and compared to a couple of years ago, we're much more aligned. So I think this is very positive. At the same time, we know that there's still major gaps, as Andy highlighted earlier. There's major gaps in understanding of what safely managed means and how to reflect that in national policy and plans, regulation, but also how to operationalize it. So we're really looking forward to working more closely with partners and supporting countries in achieving safely managed sanitation, and we'll be working more closely with UNICEF in the coming months on a joint framework for implementing our guidelines and the game plans. So trying to bring the best out of our mandates on policy and evidence, evidence to policy, as well as the UNICEF for the implementation at scale. So I'll stop here. Thanks.
Thank you very much. Thanks very much for that. I think you have mentioned quite very key things. So guidelines, you are talking about capacity building, you are talking about tools, you are talking about manuals. You are talking about data monitoring support to government systems. So I think that's a very interesting part. And those are the kind of the system strengthening that we are looking at to get governments actually to lead the process rather than us leading for them. So thanks. I want to go to the second. I'll be able to have some times to give the audience to also ask questions, but I just want to make sure that the panelists finalize a few questions that I'm asking them. I have one question for you, Andran. How have your contributions in supporting government policy and governance improvements specifically impacted the sanitation sector? So that's just one part of the question. And what are the key lessons or the best practices that can you share with the audience here regarding the successful alignment of the policy with the goal of achieving safely managed sanitation for all?
Thank you, moderator. So actually, I will share the experience from the Bangladesh. So this is how it is working. For the sanitation sector, and when the SDG turned the target for the safely managed sanitation, so it comes a very complex for the government and their overall understanding to change the mindset from the MDG, so which is much more easy to communicate. Like, can you hear? Yeah. So this is very easy to communicate for the MDG that the people need a toilet and you have to stop the defecation, open defecation. So it's easy to convey and they could set the target. But when it moved for the safely managed sanitation, so a lot of buzzword came with that safely managed sanitation. Number one, now government and the sector, even if the citizen, they have to learning about the off-site sanitation, on-site sanitation, fecal sludge, septage, the treatment. So these things how will address, and it also divide the role of the different government agencies. So the first task in Bangladesh through UNICEF and the sector partners, government took to align their all policies, because policy is the first safeguard, and it will be guide the sector to achieve some goals. So Bangladesh has a wash policy, it called the 1998 we developed, and that policy actually talk about only accessibility of the toilet and stop the open defecations. So all institutional role and also the financial alignment, capacity of the sectors and the program, everything that policy guided to achieve that one. And 2015, Bangladesh achieved the open defecation free country. So government got a one signal that our tax is over, and that could be the thing what we are looking for. So now the government realized the diversification of the safely managed sanitation and the expand of the tax of their part, and they first start to revision of the 1998 policy, and they adopted the safely managed sanitation from the containment to the treatment, so whole service chain. So that is the first policy. Then this policy actually give the sector a specific guideline to how and what type of strategy they need to address that policy. And government also address and revise their existing policy about the wash and sanitation. And then also government initiated and aligned their sector development plan, because sector development plan, it will be turned to the action plan of the policy to achieve the safely managed sanitation for the Bangladesh. And if you look like to align these all policies to address the safely managed sanitation, it took almost 7 years for Bangladesh. So then when you will address the challenge and improve the overall service provision. But the thing is, what we learned to take and go through this all journey to adjust the policy and other things, it gives government different options to access their fund. Now the international financial agencies, so they know where they have to invest for the offsite sanitation and the treatment plant. So that government is taking their big financial leverage, and that is in place. So they start construction their infrastructure to address the offsite sanitation, and they also develop the institutional regulatory framework and assign the different agency for the on-site sanitation and the off-site sanitation. So government agency also know very clearly which agency, what is their work boundary to achieve the safely managed sanitation, how much fund they need, what is their caseload, and what type of technology they have to deal. So now these funds are in place. And if you look at the joint monitoring program, Bangladesh, you will get the only country also generating the data and giving the projections about the safely managed sanitation tracking. So however, it have to go long way. We have to go 41 point to achieve. But as the finance and also institutional structure in place, so hopefully from the 2025 or 6, things will start to give the result. So till now, result is not changing that much. So this is the resetting the whole environment and the policy and the institution, and the result when it will start producing. So Bangladesh is very hopeful that by 2030, they will be at least nearer to safely managed sanitation part. Thank you.
Thank you, Adnan. You are mentioning quite very important part of the system strengthening. You are talking about revision of policy to align to accelerate the safely managed sanitation. You are talking about sector development plan being including that. You are also talking about developing institutional regulatory framework. Very, very key enabling environment for ensuring that we can accelerate the safely managed sanitation. Thank you. I want to go to the online. Rebecca, are you there?
Yes, I'm here.
Yes, so I have one question for you. And you know you're from the World Bank, so I'm sure you will probably crack this question. How does the World Bank see the sector alignment on safely managed sanitation, supporting and enhancing infrastructure investments in developing countries or developing regions? And what strategies or collaborative approaches you have been, that you think have been effective in achieving this alignment to maximize the impact of investment in the sanitation infrastructure?
Thank you so much. So I think I'll start by talking at the kind of global or multi-country regional level. We've increasingly been trying to bring together both technical ministers and ministers of finance to ensure there's a shared vision for what the sector aims to achieve for universal access to safely managed services. So the focus is really on building government ownership and having government-led platforms or government-led programs and approaches that multiple donors can come in together on. So we're moving away from this kind of fragmented approach to really bringing together multiple entities to support the government's approach. And I think we heard some really good examples from our first group of panelists on what this can look like. Then at a country-specific level, I think when we work on enabling environment, we think about 4 main areas. This is policy, institutions, regulation, and financing, which echoes a lot of what others on the panel have been sharing. So with policy, this is often either national level policy on universal access. So how do we get from basic to safely managed? How do we end open defecation? What are we doing in urban versus rural areas? It could be a national policy also on private sector engagement, which is increasingly important in the sanitation sector, where the private sector is not just a contributor of financing, and also a service provider. And then we have subnational strategies that would be more often something like sanitation master planning. And for all of these different kinds of policies, we're really focusing on not just the document that comes out on the end, but the process that gets us there, and bringing together all of the different actors, both from the government and non-government side, to ensure that the process is building capacity and ownership. So at the end, when we have the finished policy, everyone already understands it and has bought into the idea. So that's policy. Then we have institutions. As we heard earlier, the most important first step is clarifying roles and responsibilities and understanding what's going on in reality as compared to what's written on paper. And then we focus on building capacity for the specific roles an institution is meant to fill. So that could be service delivery for on-site and or sewerage sanitation with a utility, municipal department, or some other actor, but it goes well beyond that to looking at who's responsible for setting policy, who's responsible for overseeing private sector service providers, who's managing the monitoring and evaluation systems, whether at a national level for household access, and who's responsible for operation and maintenance. So we have all these different functions, and we first need clarity about who's supposed to be responsible. And second, we want to build capacity for those specific roles. Then we go to regulation, where we're thinking both about economic and environmental regulation. Regulation, I think, can look very different in different countries, depending on where the sector is at. It can start with really basic ideas of just registering the different service providers, moving up to minimum service standards, benchmarking, and ultimately trying to have some kind of regulation of tariffs and fees. This is linked very closely to the work we've been doing with WHO and others on sanitation workers and professionalizing service provision. And is also linked to this last category of financing, where traditionally we've done tariff reviews, looked at taxes and other fees that are involved in the sanitation sector, which are often more complex or just quite different from what we see on water supply. And the aim is to both improve the financial viability of service providers, but equally important is to increase access to affordable services. So we're thinking more strategically about how we use subsidies, both cross subsidies between water and sanitation, between different users, but also looking more creatively at how to use different kinds of taxes and other fees within the sector. So then going back briefly to the second part of your question on aligning actors, as I mentioned, I think the biggest way we do this is on our work on policy and thinking more about that process and less about the final paper. So you're not hiring a consultant to write a policy. Instead, you're undertaking a process of bringing together different actors from across multiple ministries, health, education, water, sanitation, as well as the range of development partners, civil society, and others, so that you're ultimately able to empower everyone to be really engaged on this important agenda together through a shared vision. Thanks.
Thank you very much, Rebecca. In fact, you're mentioning very important things, bringing dialogue, multi-stakeholder dialogue together and making sure that there's ownership with the government, as they are the ones that we are building their capacity, of course. You have mentioned financing, very important, subsidies and taxes, helping government to see how they can mobilize resources to actually accelerate safely managed sanitation, and you have actually also mentioned strengthening regulation, very key. I want to go to the last panelist. I still want to get a little bit of some time for a few questions from the floor. So I don't want to disadvantage you, but I have one question for you, Kasenga. What specific, and this is actually directed specifically to you, so you are the only regulator probably in the room. What specific steps have you taken as a regulator to enhance and adapt the regulatory framework for public health, particularly in the context of in the context of accessing the on-site safely managed services, and what are the challenges and opportunities have you encountered during this process?
All right, thank you very much. Loaded question.
Yeah, I agree.
So first and foremost, regulator works to balance the interest of the government, advises the government as well, the consumers, and the utilities that provide the services. So in our case in Zambia, we're quite fortunate that the government itself realized the need to move into the on-site sanitation fecal sludge management space. That's right about 2016, when the Minister of Water and the Minister of Local Government jointly issued a directive to the sector, in particular to the regulator, to take the lead to ensure that this particular subsector was actually looked into. Again, 2017, we had a nasty cholera outbreak in Lusaka City. Took us a while to actually combat. But that presented an opportunity and reinforced the fact that we needed to work on on-site sanitation, fecal sludge management, and fast-track all the processes. So the regulator took the lead, obviously, in a consultative process to develop frameworks, what we call service provision and regulatory frameworks, basically recognizing the roles, responsibilities of all the various players. But central to these frameworks was the fact that the utility, who are a creation of the local authority, who have come together as local authorities in a particular province to form these commercial utilities, would be mandated to provide services across the entire value chain, from the capture all the way to treatment and disposal. But that particular framework provides avenues for the utility to engage private sector, the CBOs, or even the local authority, in some cases via memorandum of understanding if it's with the local authority, and via a contract, subcontract, if it's private sector. So there's that particular mechanism. But this moves the responsibility entirely on the private and recognizes the fact that sanitation is now a public good via this responsibility placed on the utilities themselves. We went through a legal review as well to clarify and just ensure that the legal environment was actually adequate, clarify all the roles, responsibilities for the various players, and ended up promulgating a statutory instrument specific to on-site sanitation and fecal sludge management that clarified responsibilities for local authorities and for the households themselves. We're obliged to ensure that at least they constructed sound sanitation systems in line with the standards that the country has developed, a code of practice for the entire value chain. For the regulator, we went ahead to develop tools, regulatory tools. Some of it included the minimum service levels, basically rights obligations also for the utility and the consumer, stating, for instance, items of downtime or inconvenience when the utility is dislodging a particular facility, how long should they actually take, the need for the utility to ensure that they sanitize the environment and reinstate facilities after the emptying, for instance, and so many other aspects. The regulator has also developed a pricing mechanism. Now, this mechanism separates the charges or tariffs for water versus sanitation, in particular non-sewer sanitation. So this is a plus, and this is a move to ensure that along the journey we have cost recovery. And this is why I said in the opening statement, a firm believer that the sanitation subsector can equally be as viable as the water subsector. The regulator has further gone ahead to develop subcontracting tools or elements to ensure that there's private sector participation, among other regulatory tools that we've put in place. What's also critical is that we have developed a criteria for what we call a C-wise utility. This is like 10 to 15 steps. Not in any particular order, but we're saying in this criteria, utility should at least have a strategy or a plan on how they're going to deliver sanitation, both on-site and off-site sanitation as well. So this has to be recognized, at least in the strategic plans. The other element is that the utilities need to have a dedicated department, or at least a unit, with well-capacitated people focusing on on-site sanitation and fecal sludge management. This is key if at all we are going to achieve safely managed sanitation. So that's very important. And one other aspect is that the utility actually undertakes data collection via mapping exercises of the entire service area so that they understand what pertains in terms of technology and what needs to come in place. This also helps facilitate other aspects such as sanitation safety planning that Sophie referred to. The utilities under this criteria are also, I know time is running out, but let me just try and be very quick. Mandated to develop business models and service delivery models. This is also stemming from the fact that once you collect information, then you understand exactly what happens in the area. If you need to zone and bring on board private sector, this gives an opportunity, and also the CBOs. But the utility is also responsible for formalizing all the arrangements with the informal emptiers or operators, because our regulation as a regulator will go directly to the utility and we shall hold them to account for any regulation or standard that's violated at the tail end of the chain. There's also other things that we have spearheaded as a regulator or done, reporting requirements. We have formulated indicators, particularly non-sewer sanitation, fecal sludge management, that the utilities report on an annual basis. Now, this is important because this is the development phase, so we don't want to go heavy-handed with enforcement, but rather start light regulation. Information is critical. Push all the utilities in a particular direction that they have all the ingredients necessary to ensure safely managed sanitation systems.
Kasanga, will want you to just have 20 seconds to summarize. Yeah.
Last point, capacity building is very important. So both on our side as a regulator and on the side of the utility, we continue to facilitate that aspect. But you also did mention the challenges and the opportunities. I think one of the biggest challenges that in terms of onboarding infrastructure specific to fecal sludge management, that has been quite slow. All these processes require money. If you're going to comb your area, a province, in terms of mapping, that requires also resources. So a little bit of a slow process, but the uptake is good and it's looking very positive.
Thank you very much, Kasenga. Actually, you had a lot of points. I'm sorry to cut you short, but I think the audience could even just approach you. You are free to approach all the expertise here, and you can engage with them after this. I just want to allow at least one question or two. Anyone who has a burning question to any panelist. Yes. Yeah, you can go there. And then I will hand over to Andy from UNICEF just to conclude. Yeah.
Thank you all for the panel. My question is to the gentleman from Zambia. I was just hoping you could give us a bit more detail on the pricing of wastewater treatment. It seems as though that's quite expensive and energy intensive, but also crucial for public health. So I'm just wondering how you think about the trade-offs between cost recovery, access, and subsidization. So thank you.
Fantastic. Yeah, go ahead.
All right, thank you so much for that question. So previously we used to bundle water sewerage in particular pricing. So the sewerage services were basically priced as a percentage of the water bill. Now this pricing model separates. So the utility is required to account for all the costs for water, all the cost for sanitation, and then this is fed into the model. The regulator determines the level of cost recovery. Of course, we're not going to move from 50% to 120% or so, so this has to be incremental. But also there's opportunity in this model that there will be cross-subsidization between the water fund and the sanitation fund, because overall looking at the costs associated with provision of water and sanitation in totality for a particular utility. Now, one thing that we are, as a regulator, advocating for to the government is we realize this is going to take a while to really kick off as a business. We've provided for pay-slow mechanisms in the pricing system, meaning beneficiaries of the service will have to pay very slowly towards the emptying services, say after 2 years or 3 years. So that's very critical, so that we don't burden a particular household to just pay this lump sum at a go. But the government will also come in via a fund we're setting up to try and subsidize certain aspects, especially on the infrastructure side, not so much on the operation and maintenance. As I said, it's quite a challenge and costly for infrastructure development. Thanks.
Thank you very much. I think, I'm sorry, the audience, I would have allowed for more time for questions, but I think the time is running out. I really thank my panelists, very good expertise, and you are free to engage with them after this whenever you are having tea or something. Andy, can you just come and provide your conclusion from UNICEF? Thank you very much.
Thank you. Not to keep you any long, we've been on a journey today. Thank you everyone for joining. We've shared with you a little bit about UNICEF and WaterAid's strategies to support safely managed sanitation. Then we had some reflections from our government stakeholders on these safely managed sanitation workshops. And then we've heard from our panelists on a few things about how they are supporting or strengthening government systems. We heard about the importance of guidelines, about injecting safely managed sanitation into the discourse, and about how that workshop can actually help to do that and realize that it is an achievable goal and isn't just about sewers, which is maybe what some of the pre-existing beliefs are. That we'd heard many tools from the WHO about things like sanitary inspections and how to improvements in monitoring. And about updates to household surveys as well. We had that from Cambodia colleague as well about how they are strengthening their data collection. We've heard about revision of policy in Bangladesh and about how that, alongside World Bank statement as well, which is, aligns with the experience of others who are supporting the African Sanitation Policy Guidelines, which is about policy improvements is a process, not just an end policy. And that sort of aligns to what this workshop is about alignment, bringing stakeholders together. It's the process is more important than the final document. Strong regulation in Zambia helps to demonstrate. We had excellent demonstration here for what's happening in Zambia about strengthening on-site sanitation, and the role of a strong regulator, of how that is so important and missing in many contexts. And just to maybe say that, yeah, I mean, I'll leave it there. But you also took, I hope, quite a few takeaways. Please come to me or my Laura and the other colleagues to ask questions, to reflect, and I'd love to hear comments as well, and to our panelists. So please join me in thanking them as well, and thank you, everyone. Thank you. Have a good rest of the day.
And